Hello, this is Dr. Gay from First Look MRI, and this is a 26-year-old male who injured his knee playing football. And we have two views here. This is a sagittal view on the left showing the knee in profile. We see his kneecap here. We see the quadriceps tendon attaching to the top, looking normal. We see the patellar tendon coming off the bottom, attaching to the tibia down here. We see his femur, tibia, patella, looking normal. We see his fibula, the little bone on the side, looking normal. So there's no fracture, there's no bone contusion, and his ACL is right here. This is the anterior cruciate ligament, comes off the back of the femur to the front of the tibia, looks normal. Has a few little components here that fan out towards the bottom. This is a pristine, normal looking ACL. His posterior cruciate ligament, the PCL, goes the opposite direction. It looks completely normal, so no ACL tear, thankfully, no PCL tear. But he does have something abnormal here in front. There's an area beneath the kneecap. Here's the kneecap, and there's a fatty area here called Hoffa's fat pad, and this should be very low in signal and uniform. So, for example, up here, this is the prefemoral fat pad. Fat, see how uniform it looks, just homogeneous. It'll look just like fat back here, or fat in the front. But down here, the fat is not homogeneous and dark, it's bright. So there's fluid that comes out of the knee, goes down through Hoffa's fat pad, way down here to the deep infrapatellar region here. This is the patellar tendon attaching to the tibia, and the fluid goes all the way down there. So abnormal signal throughout the kneecap, so the injury of Hoffa's fat pad. Now when there's an injury here, we always look for a little ligament. It's a really tiny ligament, hard to see, but it's called the infrapatellar ligament because it's below the kneecap, or ligamentum mucosum. It's very hard to see in normal patients because the fat is uniform in signal and the ligament's very thin. But in a case like this, we see fluid throughout Hoffa's fat pad. If it were intact, we'd see a well-defined band coming down through here. But instead, we don't see that. So there's a tear of the infrapatellar ligament, or ligamentum mucosum. I think this little squiggly thing here is the torn infrapatellar ligament. And again, lots of edema throughout Hoffa's fat pad. Now we're going to look at the patient's menisci to see if they're okay. And we see with some big arrows here on the lateral side that there is a tear of the anterior horn and body right next to each other here. The anterior horn is here, the body is here, and right at the junction we call it the anterior body horn junction. We see a little horizontal band of fluid. That's a tear of that meniscus. And if we look on this sagittal view here in profile, we see the posterior horn looking nice and normal, nice perfect triangle, and the anterior horn looks like the inner margin of that triangle is torn and truncated. So we go right there, we should see the inner free margin, but it's torn. And they have a tear of the anterior body horn junction of the lateral meniscus, and there's also fluid all along the anterior surface. Fluid comes down here, so it looks like they also have a tear of the joint capsule. The joint capsule hugs the lateral side, keeps the fluid in, and the fluid is all outside, or extravasated outside into Hoffa's fat pad. It also dissects down here. If we look on the coronal view here, we see that meniscus tear there. We see the meniscus body here, a little irregular. The capsular surface, or the outer surface, instead of being smooth and uniform, is irregular. By comparison, we see the medial side. This is the meniscocapsular junction of the medial meniscus, looking nice and normal, smooth, and the outer side of the lateral meniscus is irregular, it's kind of globular, so they have a tear of the lateral joint capsule out here, allowing for fluid to extravasate and go down the lateral knee. Also, we have the lateral ligaments here. This is called the fibular collateral ligament, and that comes off the lateral femur. It comes down here, attaches to the fibula. So the fibular collateral ligament comes down and it actually joins with the biceps. So this is the biceps muscle. There's a black line. It's the tendon that's going to become more and more thick, and the muscle becomes more and more thin as we go down distally. And right here, the biceps ends, and it joins with the fibular collateral ligament to form this short conjoined tendon that attaches to the fibula. And you can see the fibula looks normal. The conjoined tendon is nice and low in signal, perfect. Fibular collateral ligament looks like it's intact. Biceps looks good. So these main lateral structures are intact, but deep to them we see this foggy area here. This is part of that lateral joint capsule that's torn. Down here we see a dark structure. This is the meniscotibial ligament, part of the lateral joint capsule. It's lax, elevated, and distally where it attaches to the tibia is partially torn and ill-defined, so it looks like they have a tear of the lateral joint capsule, the meniscotibial ligament, and also there's one other thing that looks like it's torn. This is the popliteus muscle. The popliteus muscle comes up, turns into a popliteus tendon. Popliteus tendon attaches here. That is normal in signal. Here's the popliteus tendon right here. Attaches to the femur up high, and it comes down obliquely, wraps around right here, and turns into the muscle back here. So the popliteus looks great, but there's something over that. It's called the popliteofibular ligament. So off the fibula, we have a little ligament that goes around the back of the popliteus, holds it in place, and it looks like that is torn. There's a little thing here, maybe part of the popliteofibular ligament that is torn. This is an axial view here. We're going to look at the popliteus. There's a little indentation here along the lateral femur above the knee joint, right here, this caved out area here. And this is the popliteus. There's the popliteus. We're going to follow it down around, and there's the popliteus coming down and turns to the muscle. Again, superficial, we see this fluid extravasating out, and we don't really see that popliteofibular ligament. Even in the best case scenarios, it's really hard to see, but there's a little horizontal line right there. I believe that may be part of the popliteofibular ligament that is torn and just ends right there, hanging out in the breeze. So they have tear of the lateral joint capsule and the popliteofibular ligament, but the other structures of the lateral side are intact. And the other thing they have is a tear of their meniscus here, a complex tear of the anterior horn and adjacent body of the lateral meniscus and the overlying lateral joint capsule. And on the sagittal view, tear of the infrapatellar ligament or ligamentum mucosum. So kind of an unusual constellation of findings in this 26-year-old. And thank you very much.